Our final panel will focus on the current challenges and improvements occurring in the healthcare supply chain. We have talked about everything across sort of like a supply chain in the healthcare system today, everything from how we are covered to the people on the front lines caring for us, to how hospitals are set up, to eventually what a vaccine may look like and how that will be distributed and certainly given to the broad part of our population. So today we're going to talk about the last thing to kind of pull it all together today is talking about the PPE supply chain. So please welcome with me today on stage, Michael Akire, President of Premier here based in Charlotte, Jerry Cook, Vice President of Government and Trade Relations at Hanesbrands, and John Loyack, Vice President of Global Business Services at the Economic Development Partnership of North Carolina, or EDPNC. Thank you all so much for taking the time to hang out with me today. And I'm so sorry you've drawn the short straw. You get me as your moderator. But anyway, these poor people all day have seen me way too much. So I want to hear from you all, and I know that they do too. PPE was like, most of us, those of us who are just normal lay people didn't even know what PPE stood for until March. And it has become part of all of our common vernacular. And so Jerry, I'd love to start with you. You know, we were hearing all kinds of stories about the Wild West in the early days of PPE and supply. And it seems like demand has somewhat settled down, but I'd love to hear your thoughts on what you saw early on as a company that kind of pivoted into that space that was not prior, you know, had not been into the production of PPE, and also what you're seeing more currently today.
Sure. Well, thank you, Kelly. And I just also want to say thank you to all the caregivers, both in the medical field, caregivers at home that are just helping take care of people. You know, the Wild West is probably a good way to describe it. What we saw happening in business, what was happening in hospitals, we saw friends, neighbors, people getting sick, and we saw a big demand and the term shortage, scarcity happening for the protective products that people were looking for. We're, as history of making apparel. So we decided, let's volunteer. This is what we do. This is what industry does. It runs into the problem to solve it. And our first two thoughts were, there wasn't a vaccination. There's not a cure, and they need time. And let's see what we can do. And making covering masks seemed like the right thing to do. We called up the FDA and HHS in DC and said, we own big textile operations. How can we help? And they said, make masks. And in 5 weeks, we figured out, and we thank the FDA and HHS immensely for helping us with the science and requirements. And since then, 5 weeks later, we were producing millions of masks. We've produced a little over 700 million masks that have gone out. And we view this as very critical because it's about buying time for the vaccine. And it's about giving science the time to do what it needs to do and to find a cure and to create space. And as a company, we literally took every textile capacity, everything we had globally, and converted it for that 3 to 4 month window, and offered to do whatever we could for any hospital or any medical, fire department, police department, first responder. Let us help get you covering masks and get this taken care of, because this is our neighbor, this is our community, and these are the people that are ultimately going to take care of us, and we need to help create space and time for them.
So thanks, Jerry. Mike, you are a very large purchaser in the supply chain space and have been for many years. You had really a front row seat of what was going on around the country and around the globe. What did you see early on in the supply chain capacity, and what do you see in today? Because I know you're still working with hospital systems and providers all around the country.
Yes, first, Kelly, let me just say thanks for having me on the program. Second, I'd like to echo Jerry's comment and thank all the caregivers who were those first line responders and the folks that were really caring for a population that really needed it. Third, I'd like to thank organizations like Jerry's who stepped into this huge vacuum when we needed them the most, when our population was at risk. So just a bit of backdrop, you know, Premier not only does purchasing, but we also contract manufacture for goods, both PPE as well as pharmaceuticals all across the globe. We've got big presence in Southeast Asia, China, India. So I think, what happened, obviously, from a demand side is as the virus became more prevalent, as most of you are aware, if you go to your neighborhood Costco or other market, you went out and you found out that back in January, people were buying a lot more product than that they had historically bought. And that same kind of behavior extends to caregivers, quite frankly, to providers as well as health systems and others. So there's this enormous pressure, obviously, from a demand standpoint. And then from a supply standpoint, and I'll specifically relate it to China, given that there's so much of our supply chain and PPE that is dependent on China. Historically, China always shut down during the Chinese New Year. That means they didn't ship product from January to about February 15th. They experienced COVID in a number of their provinces, which means that they weren't able to actually produce products. So that extended it through March 15th. So we had a 3-month period there that we weren't actually getting product with this enormous demand. Subsequently, there are organizations like Premier that are, we've been working with factories for a number of years, but we're trying to bring additional factories online and trying to create, supply chains very quickly, meaning getting access to the raw materials and really trying to set up as much production. To give you some perspective, I always focus on the N95. So in a traditional year in the US, we consume about 25 million N95 masks. Today, our demand is north of 325 million on an annual basis. So 25 to 325. So you can just think of other products like isolation gowns, exam gloves, needles and syringes. Those are all products that there's a huge demand for in our healthcare systems. So the net of everything is that while we are trying to bring all these products, into the country, because most of the production was done outside of our country, you had organizations like Jerry's who had to step up and fill these gaps. And boy, we saw some remarkable innovation occurring from Ford Motor Company, creating visors, working with Fruit of the Loom, who created the straps, and GM and GE creating ventilators, and Medtronic expanding their ventilator capability. But there was just some incredible brilliance that actually occurred, which I would say was the silver lining in this cloud. To answer your question around, are we out of it? Quite frankly, I don't think we're out of it, in that now we're going through a phase where everybody's, stockpiling these products for future events. And what that means is that everybody's buying 3, 4, 5 times what their normal needs are. And everybody's doing it. You got the federal government who's stockpiling, you got the state stockpiling, you've got provider stockpiling. And so, that continues to exacerbate the issue and put more pressure on the supply chain. And so we think over the next, say, 3 to 9 months, probably the next year, you're still going to experience some pretty significant shortages. But our top 5 areas that we always kind of call out are N95 face masks, surgical masks, isolation gowns, exam gloves. And again, China's messing with the market right now, and that they just doubled the price of exam gloves, which is throwing everything into sort of this unbelievable vortex of folks trying to figure out other, players that can actually produce gloves and those kinds of things. But point is, those are the areas that we've been focused on, and I haven't even talked about the drugs. So we had to step up capacity for domestic drugs. You think about drugs that are needed for patients that are being ventilated, propofol, fentanyl. You heard some of the horror stories that were happening in New York City. But we had to step up and get with 503B compounders and others to get those products as quickly. We stood up in probably a week to 10 days, capabilities to support our healthcare systems in the New York market. from a drug standpoint. So we're continuing to build out, that capability, going forward. But I will tell you, going forward, our healthcare systems, my board of directors has said never again will we be in a place where we put our caregivers, our frontline folks that are caring for the populations at risk. And we need a much more resilient supply chain. And that includes a lot of domestic and nearshore capability. I'm sorry for the long answer, but I thought I'd provide you all the insights.
No, this is great. I mean, it just shows how multifaceted this issue really is. So you talk about silver lining and you talk about never again. And so with that, I want to pitch it over to you, John. You and I have talked a lot about what's the potential for North Carolina. Is there a potential for North Carolina as far as playing in this PPE production space? So what are you hearing from companies both within North Carolina domestically and even internationally about location in North Carolina for PPE production, and or what North Carolina's potential may be in that space?
Sure, thank you, Kelly, and it's a pleasure to be here today. I appreciate the North Carolina Chamber putting together this opportunity for us to get together to share all these ideas, because these really are important topics. And I was thrilled to hear what Michael just had to say about that never again moment that a lot of folks are having. And obviously, Jerry, to the credit of Hanes organization and what you all have done, I mean, this really has been an interesting moment for us. Just by way of introduction, the Economic Development Partnership of North Carolina is known by many as the economic development agency for the state, with a focus on things like business recruiting and tourism promotion. The teams that I manage, though, are focused on existing industry and supporting the needs of existing industry all across the state. We've been working hand in hand with businesses as they have pivoted to manufacturing PPE since before the pandemic even really began to have such an impact here in the state. And it's been fascinating. And I've appreciated having that front row seat as hundreds of North Carolina companies have pivoted to this manufacturing. I mean, the one example that I give to people is that this is really a Dunkirk moment for industry here in the state of North Carolina, along with healthcare providers, in that we need to, as you heard the example of Hanes, we need to get product out there and into the hands of our healthcare providers by any means necessary. Well, the good news is there is a strong opportunity behind it. This is not necessarily just a short-term, immediate thing that we address today and then walk away from it. What I hear from North Carolina manufacturers is that this is...
John, there we go. Sorry, we lost you for a second, but you're back. Go ahead.
Okay, great. In part, it's due to the overall size of the industry. Some reports out there estimate this to be nearly a $6 billion industry. Anyone who's looking to invest at this and create something has got to be aware of those things. Obviously, the rise in domestic demand is a big part of this. We've seen increase in employment in PPE industry. We've seen almost 10% increase in the number of companies that exist in the industry. But one of the things that's especially important to consider when thinking about the overall market opportunity here for PPE is that it's more than just organizations selling to healthcare providers. I mean, this is going to be a fantastic opportunity to sell to general consumers, construction workers, hospitality workers, parents looking to buy product for their children as they go back to school. All of these potential buyers are helping drive the growth of this market. And so it's kind of exciting to see all that happen. And I think that increased focus on domestic manufacturing as well will even ultimately over the next few years allow for the industry's trade balance to shift from a deficit to surplus over the next couple of years. I do see North Carolina in particular becoming a net exporter of PPE once we get everything else under control. The response here in the state really has been nothing short of heroic. We had companies like Kitsbo, who are out in Old Fort, North Carolina, who manufacture very high-end cycling apparel. They shifted and created their own healthcare line. We had high-end furniture companies like E.J. Victor out in Morganton, who made the shift and started making like Hanes, Unify, Glen Raven, and others, all shifted manufacturing lines and began to make masks, shields. At this point, we can track at least 300 different manufacturers and suppliers that have shifted to the manufacturing of PPE in the state. And many of them started for altruistic reasons, but I can promise you right now, many of them are here because they see a long-term opportunity.
So on that, and Mike, you mentioned it, and I believe, Jerry, you've got some presence in East Asia as well. I think you have a production facility over there. Reshoring is a big issue. And lots of times it's because of cost. People don't want to pay more because something that may be domestically made is potentially more expensive. Do you think there is an appetite for governments, for providers, for hospitals, et cetera, to purchase things that are made stateside? And if so, what would potentially be an impediment to making that shift to purchase from over here? Because you said China must have come up 3 times in exactly what you just said, or East Asia.
Yeah, so a couple things. First of all, we, along with 16 of our large integrated delivery networks, including Vidant, invested in a domestic manufacturer of N95s and other face masks. So we believe so much so that we did that investment, back, I don't know, 60, 90 days ago. The answer is still yet to be sort of written, right? I mean, is there a significant motivation on behalf of the healthcare systems? Absolutely. Is there significant interest on behalf of entrepreneurs and other businesses? Absolutely. Whether the government is going to do the things necessary to create an environment for domestic manufacturing remains to be seen. There's a lot of debate that needs to occur, both from a financial perspective, an ecological perspective. There's a lot of debate that needs to occur. But I will tell you this: can American production be competitive long term? And the answer is absolutely, especially in areas that there are highly automated processes to manufacture products. So think of pharmaceuticals, right? So especially finished fill goods capabilities, a lot of API stuff. If it's highly automated, we believe that we can be incredibly competitive both in the midterm and long term, and we're going to be deploying capital to support that. We also believe that there are some processes that or some products that are used manual processes today that we believe we can automate and do them more efficiently here. But the number one priority is we've got to innovate, right? We can't just do things the same way that they are being done in Southeast Asia and other parts of the world. We are going to have to innovate, and you and I talked on the pre-call about we're going to have to step back into this place of the U.S. being that innovator of manufacturing, right? So we've lost a lot of capability. In some cases, Canada actually creates a lot more innovation from a manufacturing standpoint than the U.S. And I think our universities are going to have to step up. I think our local and state and federal government's going to have to step up. But there's a huge opportunity here, and I think that. Listen, I was born in Akron, Ohio. I actually went to Firestone High School. So if there's anybody that's got a little bit of domestic manufacturing juice in their blood, it's me. But I think it's the time right now, especially in those categories that are very highly automated, that we absolutely need to figure out ways to bring that manufacturing back domestically.
So as one who's from Greensboro, North Carolina, he's grew up in a textile family and has driven by the big football in the sky in Akron, Ohio on the highway, and the big, lived in Detroit with the big tire coming out of it, Michelin. I've been there, and I'm totally, which is why John and I have been working together more and more. But, Jerry, I'd love to hear from you because, if what would it take for a company like Hanesbrands, and you're very large. I mean, you're very large. We have lots of smaller entrepreneurs all across our state who are interested in getting involved in this. But what would it take either from the government, like what Mike was talking about, or from a regulation standpoint, or even from the market, to encourage and incentivize a Hanesbrands to really pivot long-term. And I can't even stand I'm using that word, because between that and PPE, pivot has been like the second most used word of the year, but pivot into that market.
That's a great question. There's a couple of things. One, John certainly represents a part of the state that's out there trying to bring it back. You know, the hard parts are there. This is a state with great medical operations. We should be a PPE. We should be the innovator state of all things medical. We have that. We have smart people, highly educated, quite capable. To bring it back on shore, though, there's a few things that we have to deal with. One is we've got to get rid of this terminology of what is essential. That's probably one of the worst things that somebody came up with, is who's essential, who's not, and then started triaging all aspects of life. And if you want to bring manufacturing back, you cannot have them operate in a world where somebody outside the manufacturers dictating the terms. Second is we need to transition to a world that defines and lets science be science. So instead of having a government say you can be open, you can't be open, we need to agree that science is the underlying data. Let it flourish, let it go, post it, and we all see it. And if we understand the facts, we can all then operate against it. But we've used, unfortunately, non-scientific methodologies and descriptions to hold back manufacturing, and it's kept people from coming back into the state and building PPE. And then the third is we got to find a way to have kind of a combined demand signaling if you're going to produce and really draw the innovators, because you need volume and you need to have it level set. Not to say people should buy things they don't need, but you know, you look at what the defense logistics, how they buy, it doesn't really make sense to manufacturers. They just did their gown order. I think 60% went to somebody who's really not a manufacturer. And so you wipe out the whole purpose of innovating, and you can't afford to walk away from those volume opportunities and let them be used for that when it should be used to help stabilize demand for the full medical field. And that is something that state and federal and the private sector have just got to synchronize. And then the third is we've got to figure out who do we really want to be selling. And if you want people, you know, Hanes or others to come in and manufacture, then you've got to take the handcuffs off. Today, for example, there's a lot of products we can't make and sell to the federal government and certain state governments because the prison industry has first right of refusal on. So if you want me to, you know, if you want companies like us to come in, you cannot have a non-whimsical system that's out there that decides on non-market condition who gets it. And then the last is, I think, really go back and relook at the standards in which products made. I would argue we're at a great time point, and North Carolina could be that lead state to change some of the basic gowns that are out there, not for surgical, but move them into a gold standard like a Good Housekeeping, instead of having them stay classified as an FDA regulated product. And we saw that with bringing covered masks on. I mean, the federal government, give them a lot of credit, they issued the emergency use authorization. Well, why not just make that the standard going forward so that companies can bring product to market faster? And if it meets that, we have great laboratories, have them tested, and give people control. I mean, look at what LabCorp is able to do here in North Carolina. They're able to bring testing equipment that I need to know how I'm doing. My employer needs to know, the government needs to know. So let's turn that back over to the private sector. And then the other is, let's also remember some of PPE is about buying time. And so let's make sure that we're doing PPE that gives the chance for science, the companies like Pfizer's and others to make the vaccines, and that this is part of it. But when the vaccines come out, let's be in front of that so that you don't have people saying, I'm not going to take the vaccine. I don't want to take the cure. I understand the skeptical there, but the other side of it is we are a science-based state. We should use research, technology, and data to drive what products need to be made, both in PPE as well as in medicine, and then align those two together. And unfortunately, it looks like in the PPE thing, where we're trying to bring PPE back, you've got some, naysayers out there that are saying, hey, if we develop the vaccine, because it's now for some reason a political decision whether I'm going to take it or not, we cannot let that drive the market. It needs to be driven by good data and good science.
So John, let me ask you about market and what you're hearing from companies around our state and elsewhere. What do you think would be needed for them to get into this production arena? And I ask these questions, it's strange. I'm standing back thinking, here we are talking about manufacturing of product in a healthcare conference, and yet little did we know how important issues like PPE are. So I'd love to hear your thoughts on what you're hearing from companies and potential obstacles and what it would take for them to get into this market.
Sure, Kelly. I recently became aware of some efforts made by the government of Taiwan recently to deal with the same issue that we're dealing with here. And what we're hearing there is that as their manufacturers pivoted to the manufacture of PPE, they worked with the government. They worked with the federal government to provide them with forgivable loans for machinery that they would purchase. These are not insignificant costs to purchase these machines. That combined with the Taiwanese government's commitment to purchase 60% of PPE manufactured in that country are what helped to make and provide that predictability that the manufacturers are looking for. Ultimately, market predictability is a real issue for businesses, and anyone who's considering making a multi-million-dollar capital equipment purchase is going to think twice. They're looking, a couple years down the line to see what kind of an impact and when they might be able to make something on the investment that they'll be taking. They're not going to do it if these gowns and masks and other things that they produce can't be sold. I take calls every single day from businesses who are looking to break through to the buyers here in the U.S., whether they be here in the state, whether it be directly with one of our healthcare institutions or with the federal government, for example. There is no doubt a gap between manufacturers and the buyers here in the U.S., and it's going to take us some time to bridge that gap. I will certainly put myself out there and say that for any of the healthcare providers on the call today who would like to be put in touch with North Carolina manufacturers of X product, we're happy to make that introduction. We know who these people are. And as Jerry described, that's one of the roles that we play, and we're going to have to make sure that people are aware of what finished product exists, as well as letting major manufacturers know what elements of the supply chain are here. The good news is, I think a lot of what we need is here in North Carolina. We're tapping into our heritage industry of textiles. We've got the workforce. We've got the R&D centers. We've got a whole variety of things that you need to stand up an industry like this. And so I think we're in a very good position, but there are still some serious obstacles that we'll need to address.
So Mike and Jerry, I want to ask you guys, what have been kind of your key takeaways from this crisis? Because as I have seen with COVID and what's happened in just what I do, with every challenge comes opportunity. And so what have you two seen? And Mike, I'll start with you. What have been your real takeaways? Because certainly none of us imagined we're doing a virtual healthcare conference right now, in September of 2020. So what did you see and what have been key takeaways for you from this crisis?
Yeah, so there are 5 takeaways for us at Premier. The first is more transparency. Transparency in terms of where products are actually being manufactured and where those raw materials are coming from. So I'll just use a quick example in pharmaceuticals. Everybody talks about the API, or active pharmaceutical ingredient. The FDA does a really nice job of understanding where those are being produced. Unfortunately, the FDA doesn't know where the raw materials going into making those products are being produced, nor the excipients. Those are the supportive products that go into the finished goods. We worry that there's probably somewhere between 60 and 80% of the materials actually being produced in China. So we've got to really think about how we're diversifying out of China. Number 2, and this goes right to that comment, we've got to create more regionality. So to the degree that there is, we're going to still need low cost producers of products for generics and commodities. By definition, they're low cost. We've got to create more resiliency in the supply chain, meaning, we need to look at other low cost countries to fill some of those gaps. And so, if that means, Malaysia and Thailand and other nearshore options, we've got to do a better job of looking for those opportunities. 3, you heard me say this, we have to do more domestic manufacturing where it makes sense and where these entities can actually truly exist long term, because they have some capabilities that they're technology enabled, they're highly automated, those kinds of things where they can compete long term. So we're really big on that, and we're going to continue to look for partners, from that standpoint. 4 is we need more technology. I think Jerry said this. But, the demand signals are really, really critical. And obviously at Premier, we represent close to 50% of the healthcare systems in the US. We can create those demand signals as an entity, but we need to do a better job going all the way back into our 200,000 non-acute facilities and the 4,000 hospitals that we represent. So we need to have this stronger technology enablement of understanding inventory levels and future needs and those kinds of things. And so we've been building out and making investments over the last couple of years to do that, but those demand signals need to get stronger. And they need to give confidence to manufacturers that there's a long-term stream of opportunities so they can invest capital in plant and equipment and those kinds of things. So that's number 4. Number 5, but it's all that technology enablement. And number 5, we think we need an infrastructure 2.0 kind of play from the federal government. Everybody talked about infrastructure 1.0, which was, had bipartisan support. It was all about developing roads and bridges and getting everything sort of, updated from a infrastructure standpoint and bringing new jobs back to the US. We're now saying we need an infrastructure 2.0, which is focused on domestic manufacturing of medical surgical products as well as pharmaceuticals. We need the federal government, the state governments to support that premise and create mechanisms that actually, sort of grease the process as opposed to slow the process. So, this goes to FDA, this goes to EPA, there's a number of federal government agencies that I think need to be included in this. But we truly believe an infrastructure 2.0 program would be a sentinel. We'll send the right message at a sentinel moment. So that's our thinking.
Love it. I love it. Jerry, how about you?
Yeah, there's several things that look at. One of the biggest is we believe now's a good time to do a rethink on the whole regulatory structure. Not talking about the surgical rooms, but we're talking about just looking at all the regulation that goes on PPE, and is it really that necessary, and does it need to be that tightly controlled at the state and federal level, or could you move to industry standards? And that's driven from, I think the COVID really brought it home that healthcare does not exist inside just hospitals and medical centers. It exists when you go to Costco, it exists when you go to Walmart, Target, when you go out with your family So healthcare is well beyond the brick and mortar of the institutions that people think about. And PPE is outside of those institutions as well. And you see that today. It's been talked about: wear a mask, social distance, wash your hands. Well, that's true outside those brick and mortar. So we need to move the PPE to where people live and work and have access and understand it. The other is, we need to make sure that organizations like the Chamber are strong and healthy. You guys are doing a great job. You pull people together. You talk about what the problems are. And look at today, you bring people together to start discussing, solving it, and bringing it home. And that's extremely important, because that's not happening everywhere. The others, we need to learn and teach people how to manage risk. The idea that you're going to, manage COVID by shutting businesses down, telling schools not to be open, is just, that's not how you live. You live by managing risk. And that goes back to, what's the science? Where's it coming from? Let's get the data out there. In this situation, you do this situation, here's the way you do it. And then the other is, we need to build a truly integrated, and I like what Mike said, it's an infrastructure 2.0 approach. And that is, you cannot build PPE in the United States and it not be cost effective. That's not fair to the consumer, the taxpayer, to the insurance company. So we've got to create a very economically competitive onshore, and it's going to include parts from offshore as well. We have an integrated global economy. This should be probably fit inside of that. And then the last piece of it is we need to use what we have best, and that is to unleash North Carolina. Let North Carolina businesses solve it. Let us get together and have the government support it, not lead it. And I think today our problem has been, governments have tried to control and manage it by using tools that are just not designed to do this. And we need to step back and really just unleash the knowledge industries we have to go out and drive. But keep in mind, this is about giving people their lives to manage, to be responsible for, and not somebody else manage it for it. And then that in turn makes people like John very successful, because that draws us and others to come in, because then we know what we're going to make and when it's needed and how, and to put it forward. And that puts us all together as a community, as a state, making our lives better.
Yeah, I couldn't agree more. And as a native North Carolinian, and certainly I'm a huge champion of all the assets we have here. And, whether it's our healthcare expertise with our university systems, we really do have like a knowledge corridor running through our state. So with that, John, talk to us about what is really needed to make North Carolina a PPE leader in production. Is this, to Mike's point, he really thinks it potentially is a long-term potential opportunity, but obviously there are obstacles in the way. So what would it look like for North Carolina really to become a leader in this?
So the good news is, I think that North Carolina is positioned better than any other state to lead in, and I think North Carolina will become known as a worldwide leader in PPE production. I say this knowing that we have a lot of the elements that we need in place, whether that's the workforce that's needed, whether that's certain elements of the supply chain, the R&D and the innovation labs. A lot of what we need is already there. We need to raise awareness of what's there. For example, I'd be willing to bet that many folks on this call don't know about a resource that's a part of the community college system out in Little Conover, North Carolina, called the Manufacturing Solutions Center. And this is a brilliant facility that can do all kinds of filtration testing on materials that are then used for PPE products. And incidentally, if you'd like to take some of your product that's made in China and bring it out there, they can show you how it's not an FDA certified product as well. And so we really do have some amazing assets like the Manufacturing Solutions Center, as well as facilities like RTI here in the Triangle. We have a lot of what we need, We need to raise awareness of them. And then it comes down to some of the obstacles that we've identified here. Certainly a big part of that would be things like, as Jerry mentioned, some of the regulatory challenges we're going to deal with, as some of the procurement issues that we're going to deal with. Those are the types of things that we'll need to get through. I think we need to spend a little time as well letting folks understand that, and we've worked with some federal partners on this, on some reshoring efforts, to let folks see that there are a number of things that are currently made overseas, certainly somewhere between 20 to 30%, that could be made with similar levels of profitability here. We've got to have these conversations to let folks know all of the hidden costs that go into the manufacture of some of these products overseas. And I think we could see more of that come back here to North Carolina. But good news is, I think we've got a lot of what we need, Kelly, but we need to do, I think we need to do a little bit more research into understanding fully what's here and then taking advantage of all of it.
Yeah, you and I are talking about doing a gap analysis on what we've got here. So it'll be interesting to see what we can pull together from that. So kind of to wrap it up, I'd love to, if each one of you would tell our audience one thing that you have learned from these last kind of 9-ish, 8-ish months. And what would be, if they left this panel, what would be the one thing you'd want them to remember from their time today with you? Mike, how about you first?
Yeah, first I would just say the ingenuity of the American people. I mean, when our backs were against the wall and things were happening in New York and Seattle, I don't think people know how profound those issues were. But the way that everybody stepped up, I just think that was amazing. And I guess that goes part and parcel with, we should never allow having such critical products be, isolated to maybe 1 or 2 countries. We need to be a lot more thoughtful around where those products are being produced and make sure we've got the appropriate resiliency in the supply chain.
Awesome. How about you, Jerry?
I think, for me, it would probably be a couple of pieces. One is we should control our destiny, and we can. We have the science, we have the knowledge, we have the people. I mean, listen to your panels before this one. I mean, just incredibly brilliant people who operate wide spans of just everyday delivering great things to the state. And the second is we need to just get government kind of out of the way so that this industry and the people can come together to execute. And we say it, we talk about it, but literally we just need to just, throttle down and go fast and hard and somehow find a way to just have government step aside. They can operate the billboards of, this is the science and the data, it's out there if they want to do that. But there are so many solutions that can't come to market today or being bogged down just by a bureaucratic process that people like John, he's going to plug things together and help make it happen. But he's hamstrung by these processes and people. And we just need to unleash the power of business and science together. I mean, look at what, Pfizer and others are doing. And, they're bringing, my wife had breast cancer many years ago. I cannot thank them enough for having the chemistry and the biologics that she's alive. We have 2 grandchildren. She's healthy. What a wonderful place to live and work. And we just need to keep doing that over and over and better. But government kind of needs to move to the side.
All right, John, you it.
Two quick things. I'll just say that in terms of what I've learned that a 100-year-old sock manufacturer from High Point, North Carolina, called Harrison Covington, can make some great PPE products. And what would I like everyone to know? I would just say there is likely a PPE manufacturer somewhere in your neighborhood. And what I would say is if everyone could just make a little, to all the healthcare providers on the call, anyone making a little bit more of an effort to understand what kind of made in North Carolina product we have will help us just make this industry take off.
Awesome. Guys, thank you so much for your time today. First of all that you've done, all that you continue to do. We just look forward to hearing from all of you and working with you in the future.